Noon or good evening, wherever in the world you may be. I'm Norma Samuel, and I'm president of the board of GFRAS, and I am also an extension agent and associate district extension director here at the University of Florida Institute of Food and Agricultural Sciences, UF-IFAS Extension. At our GFRAS annual meeting in 2019, it was brought to our attention that we have a lot of farmers who are suffering from mental health issues, and our stakeholders thought that it would be valuable for GFRAS to present some information regarding mental health in agriculture. So this is a space that we have experts at the University of Florida working in, and the University of Florida is very thrilled to collaborate with GFRAS on this important issue so that we could not only provide the support that we think that our extension professionals need to help farmers, but also to make sure that we position these farmers to have a healthy lifestyle and be able to function well based on all the stresses that they face in the industry. So with that being said, I'll pass things over to Carl for a few words, and Carl is our executive director for GFRAS, and then I'll introduce our speakers.
Thank you very much, Norma. Yeah, I also just want to say thank you to the University of Florida and to the presenters today for volunteering to come and help us with this important topic, and welcome to all the participants. I hope this will be an interesting start of the series of webinars that we are running on this subject. And I think it is a thing, it was very clearly when we discussed it at the global meeting that this was not something. The discussion was initiated by issues in Europe, but it was actually really a global issue. Everybody from around the world participating in our global meeting said that this is an issue in our country. And it's something in many countries, it goes completely under the radar. It's either something you don't report about or it's something you don't talk about. But it is a reality that you as a service provider to farmers meet in your everyday work. And you often don't feel equipped and ready to, what do you do when you meet a farmer in severe distress? You are an expert in poultry or in plant diseases. You don't really have the skills and the capacity, and that's what we are trying to look into with this webinar. So I really hope that you will come out of this series of webinar with a better understanding of the challenges that people who come and regularly meet farmers face, and the challenges that the farmers face, especially during a pandemic as the one we have now, where the value chains and the ability to get farm inputs, to get farm labor, and to get your product sold has been severely constrained, which really adds a lot of distress and stress to farmer families. So this few words from me, I'll give the floor back to you, Norma.
Thank you, Carl. So as we go through today's session, if you could please type any questions you have in the Q&A, and that's at the bottom of your screen. You could see the two, chat, icons there that says Q&A. That's where we would like you to type your questions, and we will certainly have your questions answered. If we run out of time, we will forward your questions to the presenters and have them follow up with the answers for you. So with that being said, let me introduce our first speaker. She is Dr. Heidi Radunovich, and she is an associate professor and extension specialist in the Department of Family, Youth, and Community Sciences at the University of Florida. And she's also the program director for UF Extension Engagement. She is also a licensed psychologist in the state of Florida. Her teaching, research, and cooperative extension activities are related to rural and farmer health and mental health, disaster stress, and military families. Previously, she served as a faculty member at the National Rural Behavioral Health Center at the University of Florida, where she focused on child and family mental health, school-based prevention and intervention, teen risk behaviors, and disaster stress. Dr. Radunovich completed her undergraduate degree at Washington University, majoring in psychology and Spanish. Her master's and PhD in clinical psychology were earned at the University of South Florida, where she specialized in child and family therapy. And she's a licensed psychologist in the state of Florida. Our next presenter will be Terasa Younker, and she's a research associate and grant coordinator in the Department of Family, Youth, and Community Sciences here at the University of Florida. She has a master's in sociology from Harvard University and is a mental health instructor for the National Alliance for Mental Illness. So I would really like to thank these two ladies for joining us and sharing their expertise with us on the global scale. So thank you, ladies. And I'll turn things over to you, Heidi.
Thank you so much, Norma. I really appreciate you asking us to come and speak on this really important topic. It has been getting more press lately, especially with COVID-19, which has certainly complicated things. Before we get started, I just want to say that this work that we have done has been supported by a grant from USDA NIFA, the Southern Region Farm and Ranch Stress Assistance Network, with AgriSafe as the lead, and also IFAS Extension. So I'm going to go ahead and get started, and I'll tell you, we're sort of going to be covering many things in these first two webinars. And what we decided is it would really be a good idea to talk about mental health generally. I think, you know, a lot of folks notice that there are problems, but they don't necessarily have that basis in mental health to understand what all this means. And this is really important as we start looking at the research literature, because it is so mucky, because people are looking at different things in different ways. And there are also really big differences in countries and the cultural context. So we decided it would be best to spend the first part of this talk just giving some information on mental health to sort of ground this, which I will cover. And then in the second part of our talk today, Teresa is going to be covering an overview of farmers' mental health and what we know about that. And in our next talk, which will be next Friday, we're going to be focusing a little bit more on applications. So talking about managing stress as well as programs and interventions that can be used, which I think a lot of folks are interested in. What can they actually do in their communities to help this situation? So I'll start out with talking a bit about mental health, and I'll talk a little bit about why this is critical, how we conceptualize mental health. There's a lot of things that I think many people don't really realize as far as how we get diagnoses, the diagnostic categories, how we even think about mental health. And I'll talk a little bit about rural and agricultural mental health and the impacts of COVID-19. So why is this important? Okay, you're all here today, so probably you've been sold on this already, but it is prevalent in our society, not just among farmers or people in agriculture, but in the population at large. And when people have mental health issues, they can have a significant impact on their own functioning, but then it also trickles down to everyone around them, whether it's their business, their job, their community, their children, their families. So it can really affect a lot of people and not just themselves. And when we look at how many people are affected, it's relatively consistent across the world. We see it here in the US, but across the world also. Around 10% of the population live with some sort of diagnosed mental health disorder. And that affects about 25% of actual families. So you can see that spread right there, just in the family situation. That doesn't even take into account people you work with or your business or other sorts of things. People who are most affected oftentimes are not able to get treatment. And this has certainly become worse during COVID-19. It's getting harder and harder because so many people with COVID-19 are now needing more mental health treatment. There's a lot that we still don't understand as far as the why and the causes of mental health problems. We do know that stress certainly increases people's likelihood of having mental health problems, but there have been a lot of things, and we'll talk about that in a moment, that sort of contribute to why people have it. In some cases, it's very much biologically based. There could be neurological or genetic factors. In other cases, there might just be, tremendous stressors. But if you have an actual mental illness, it isn't something that you can just sort of get over. I know sometimes people feel like, oh, well, snap out of it, feel better. And you really, if you have a serious mental illness, you can't. That's not something, it's not about willpower or, your character, things like that. So I'm just kind of throwing that out there. So what do we know about causes? There's some information out there, but there's still a lot that we need to know, and there's a lot of research that goes on about this. There has been indication that genetics plays a strong part. So if you come from a family where there are a lot of folks who have suffered from depression or anxiety or schizophrenia, then your chances of having those issues increases dramatically. There have been some issues that people seem to have that are related to neurology and some of the things going on neurologically. And there has been more attention that is being paid to that. Hormones and shifts in your hormones can change the way you feel. And so that is something that they certainly look at. One thing to be aware of is that, at least here in the US, I think that we have a lot of drug companies that kind of push this story that it is about a neurochemical imbalance. However, the research literature really doesn't bear that out. And so that's something to keep in mind, that, this isn't something that we can just sort of take an x-ray of your brain and see what's going on. We can't just take a blood work like you would with, say, cancer or some other health issues. And we're really not necessarily seeing it. We have seen that medications that change your neurochemical balance can have an impact. And so a lot of, especially the medications for depression, do that. But that doesn't necessarily mean that your depression was caused by any sort of neurochemical imbalance. So this is something that's still very much being looked into. And then the last thing is stressors. And we know that when people are experiencing a high amount of stressors, that this increases their vulnerability to have mental health problems. And it can be really tough for people to get treatment for a lot of reasons. And the first one is just identification. And so for a lot of people, they may not realize that they have something wrong. Sometimes when you're in the throes of things, you can't necessarily see it. And I also think that, people don't necessarily want to see it because there is a lot of stigma that has been associated with mental health problems, much more so than regular health problems. If you have a broken arm or if you have cancer, I think people tend to understand, but because historically, the way that we have treated people with mental health problems, there tends to be a lot of stigma. So people may feel reluctant to even admit to themselves that they have a problem, and are less likely to try to find treatment. So this is something that we are still seeing. Things have improved certainly over time, but it is still something that is problematic and gets in the way of people getting the help that they need. Availability of treatment is huge. And this is something that we'll discuss a little bit more later, but this is especially problematic in rural areas. And it really varies by what country you're in, of course. But at least here in the US, we simply don't have the number of providers to meet the mental health need right now. Even in urban areas, it is very difficult. And in rural areas, much more so. So getting that access is extremely challenging. Depending on the health system that you have, being able to access treatment can be challenging because it may or may not be affordable. So if you are requiring medication, you may or may not have insurance to cover it. You may or may not live in a country where, you know, the country pays for it and it is available. There may not be medication available, but it can be costly. And particularly if you engage in some sort of mental health counseling, that's kind of a longer term commitment. It takes a lot of time and it can cost, at least here in the US, it costs a lot of money for people and is not always well covered by insurance. And by well covered, I mean, maybe you can get a few sessions through your insurance, but they may not cover all of your sessions that you need. Sometimes people have to go for counseling for many months or even years, depending on what their issues are. So it can take a really long time. And for a lot of people, they just don't have the patience for that. So that is certainly an issue as well. So the next thing I want to address is how we conceptualize mental health and mental illness. And these are really not quite the same thing in the same way that when you think about the difference between health and illness, right? We're not necessarily talking about the same thing. And so I want you guys to really think about, is mental health different from mental illness? And I would argue that it is. I think in the research literature, often these issues are sort of mushed together. And we find that people are talking about sense of well-being, which is maybe a piece of mental health. Other people are looking at depressive symptoms or diagnoses. And these are all very different things and they're measured very differently. So I think it's important to kind of consider whether we're talking about illness or some sort of an actual mental health diagnosis, or if we are talking about people's maximal functioning in the area of mental health and having a high level of well-being. And so those are kind of different animals. And it can be really tough as we look at this research literature to make sense of it because everyone's looking at different stuff and they're using very different measures. I would also say that our conception of mental health, what is mentally healthy and what is considered, quote, normal or abnormal, really varies very much from context to context, from culture to country. There's a lot of differences, and we know that in some countries, we really think about, you know, mental illness. We think about things like, you know, are you being social? Are you engaging in social interactions? Whereas in other countries where people are more independent, that's not necessarily considered. Our thoughts about, you know, things like ataque de nervios, which is something that occurs in Latinx cultures, but it doesn't occur in other cultures. It's kind of like a panic attack, but not really. So there are real differences as we look across the world. There are also differences in culture in what is sort of standard. And sometimes the measures that we use to assess well-being or depression or anxiety, many of them have been developed in Western countries. And when we try to apply them in other countries, the norms are a little bit different. For example, in China, some of the Western measures of depression show that it's like normal for their population to show a certain level of depression that you wouldn't expect. So there are definitely some differences across countries and across cultures in what is considered normal, how it is conceived, and how we even think about what is mental health or what is mental illness. There are some additional issues that come into play as we deal with this. There's, I spoke a little bit earlier about stigma, and in different countries, certain things might be okay. For example, we may not talk about mental health problems, but I'm having an ataque de nervios, and that might be okay, right? I think that so stigma works differently in different countries, and we need to consider that. I think that the level of insurance and how those work varies from country to country as well. You may not even have insurance. Everybody might be on their own. The type of providers available may vary from country to country. Here in the US, drug companies play a very big role in what is used for care, and they drive a lot of the research on medications that are used for treatment. And as a result, a lot of times people are very much thinking about this in more of a medical model for mental illness. And in other places, that is not necessarily the case. But, there is a lot, as I mentioned earlier, that we still have a really difficult time wrapping our brains around. So we really still need to better understand what's going on that is causing, because if we understand the causes, we will be better able to tailor our treatments. We really need to have a better understanding of what is going on from culture to culture as far as what is normal and what is not normal. We need to kind of be conscious of the fact that there have been efforts to sort of medicalize all distress. And, life is meant to have a certain amount of distress, and some of that is okay. For example, grief, like we expect people to experience grief, and that shouldn't be considered a mental illness. As we look at some of our ways of garnering diagnoses, we have to kind of keep in mind, like, how accurate are these? And I'll talk in a minute about what we use to come up with these diagnoses, but there's a lot of overlap among our diagnoses. And what we have been using mainly has been categories, for example, depression or panic attack. Those are very specific categories. And each of those categories has some specific symptoms. But we can also think about mental health and well-being as more of a dimensional thing. So thinking about, are you at a higher functioning or lower functioning in particular arenas? And when we conceptualize it in that way, we think a little bit differently about what treatments we are going to give. So we need to kind of consider what we know about diagnoses and how they've changed over time. At least here in the US, in order for you to get any sort of coverage for your treatment, you have to get a diagnosis first. That is what insurance companies require. And sometimes people don't want a diagnosis. There can sometimes be some fallout from doing that. If you want government jobs or particular things, having a mental health diagnosis can be problematic. So there can be some stigma that comes along with that people need to deal with. All right, I'm going to talk next about how we come up with these diagnoses. So our conceptualization has shifted very much over time. Worldwide, there are 2 different manuals that are used to come up with diagnoses. Here in the US, the main manual that we use is the Diagnostic and Statistical Manual, and right now we're in our 5th edition. And this is something that's developed by the American Psychiatric Association. In a lot of other countries, they use what is called the ICD, or the International Classification of Disorders. And right now we're in somewhere between 10 cm and 11. We're sort of in transition right now. But both of these use that categorical approach where you have a diagnosis that includes specific symptoms. But these books that we use for diagnosis have changed over time, right? So the DSM, the first edition was in 1952. And that edition was a lot skinnier than the edition that we have now, which is a lot fatter. And we have more diagnoses, we have different criteria, it shifts over time. The first ICD-1 was in 1900, and that didn't even really have any sort of, people didn't really think about mental health diagnoses very much at that time. So it's really shifted. Okay, so for the ICD, again, this is sort of in transition right now. At this point, they have taken the diagnoses in the DSM-5 and the ICD, and they're pretty much in alignment. One difference that remains between the two is that the DSM is more focused on ability to function. So you may have a bunch of symptoms, but if you aren't showing a lack of functioning, you wouldn't necessarily get a diagnosis, where the ICD doesn't necessarily have that. The ICD also contains all medical diagnoses. So this is for any sort of health issue that you might have, whereas the DSM is specifically for mental health disorders. And here in the US, we do use the ICD for health diagnoses. So our most recent version of the DSM, just to give you a sense of how this continues to shift and our perceptions of what things are and how we define them shifts over time, the process to revise it actually started in 1999, and the new edition arrived somewhere late 2012, early 2013. And, so they spent a lot of time working on this, doing field trials, trying to get consensus. There are a lot of people involved in this work, but a lot of it comes out of the field of psychiatry. So it does have more of a medical model feel to it. It also includes scientists who are doing research and field trials, but there is also a big influence from the drug companies and looking at what they are seeing in the medications. It's like, well, if this medication can help this problem, then we'll call it depression. So there's definitely, there's some politics involved in the DSM, and that's something to be aware of. Also, sometimes there can be a lot of disagreement in what should be included. And at the end of the day, people need to come to consensus. So maybe I think that there should be 5 symptoms, and Teresa thinks there should be 3 symptoms. So maybe we'll compromise and there will be 4 symptoms. So, what does that mean exactly? Because so we compromise on 4, but is that really correct? I mean, maybe 3 is okay. Maybe we really need 5. I don't know. But there can be a lot of time pressure to kind of get this out and going. And so sometimes people compromise on some of these things, and it kind of makes you wonder about how valid is this? And that's why they're continuously trying to get new knowledge and keep it up to date so that, we're working with the newest, best knowledge that we have on these topics. All right, now I'm going to shift over to how we actually come up with these diagnoses. We need to do some sort of assessment, and what is done is driven by what is it that you want to know. So, for example, if I came in and I was talking about concerns about depression, what they would do is they would try to get a history of what I've been through, how long have I had these symptoms, describing what is going on with me. Often they will give some measures, usually more than one measure, because one measure isn't really considered, enough to give you a diagnosis. They would usually give more. There might be some other people in my life that they ask for information or ask to complete measures. There might be some standard interview questionnaires that are used. And there might be some observations that are done or other tests that are done. But if you look at this, it's very much about report, right? So this is stuff that I need to be aware of and I'm able to report on. It's very about my subjective experience. So again, very different from health issues where it can be a lot more conclusive with more objective tests. We don't really necessarily have objective means of determining diagnoses. So our assessments kind of use multiple modes. But at the end of the day, it really is about people's subjective experience and their expression of it. So all of this is integrated into a report. Okay, so now that I have some sort of diagnosis, that doesn't necessarily mean that services are going to be available. And this is a problem certainly here in the US, but it is a problem in many other countries as well. Availability of mental health providers. Gosh, it seems like we have a lot of folks who graduate from mental health programs who are interested in doing counseling, but we really can't meet the demand that is out there for mental health need. So that is really challenging. All right. I'm going to go through a few of the kind of more common types of diagnoses that people might get, just to kind of have that on your radar screen as people talk about this or think about this, so that you kind of know we're all on the same page as far as what we're talking about. I'm going to talk about some of these mood disorders. And some of the more common ones that you might hear about would be major depression. That's one that a lot of people are very familiar with, as well as bipolar disorder. So for major depressive disorder or major depression, this is something where you would need to have at least 5 of these symptoms, right? And we often think about this in terms of being sad and feeling down. That is sort of a major one that people tend to have. And it's not just something that you would feel some of the time or a little bit of the time. This is something that we would expect people to feel a lot of the time, like most of the day, nearly every day for a period of several weeks. But there are some other things that we would expect if somebody is feeling depressed. So feeling just kind of tired, no energy. They may sleep too much, or they may have difficulty sleeping at all at night. They may experience weight gain or weight loss. They may feel worthless or guilty, have difficulty thinking or concentrating, maybe thinking about not really wanting to live anymore. And then just generally not taking pleasure in life is another big indicator that somebody is experiencing depression. It's important to keep in mind, though, that this can't be due to a big loss that someone has had or some other medical condition, because sometimes medical conditions can make people feel these symptoms, but it's not necessarily major depression. It's just related to another medical condition or perhaps a side effect of medications. And at least with the DSM, there needs to be some sort of social or life impairment. So problems doing your job, problems being a good person in a relationship, difficulty being a parent or attending school. Bipolar disorder, this is something that people used to call manic depressive disorder, manic depression. And sometimes people think that this is about just having mood swings. And certainly there is a degree of this, but it isn't just like, oh, I'm happy now and I'm sad later today. This is very dramatic shifts in mood. And this is something where your lows are very, very low and your highs are basically what we would call mania. So you are not thinking clearly under those circumstances. And so it's usually not something that we would see. People don't usually cycle so rapidly. There are some versions where you can cycle rapidly, but in most cases, you would, maintain this phase for perhaps a week or two at a time, possibly longer before you go into the next cycle. And that high can feel really great to the people who are experiencing it. However, they are not thinking clearly. And so sometimes this can cause some really big problems for people. People can engage in things like gambling or leave their spouses, or, engage in illegal behavior. So there can be a lot of problems that come from that mania, but it can feel really good when you're undergoing it. And then the low of the severe depression afterwards can be really, really challenging. Many of you have heard about anxiety disorders. Specifically, I'm going to talk about panic disorder and specific phobia. So this is where panic disorder is where we think about these panic attacks that a lot of people can experience. And I know many people think that they're experiencing panic, but in a lot of cases, it's not an actual panic attack. We can feel a lot of anxiety, but it's not necessarily a panic attack. Panic attack is very much a physical feeling that people will have. There will be racing heart or palpitations. Oftentimes there's feelings of sweating and shaking. You might feel hot or cold, numbness or tingling. And, you might feel like you're choking or have chest pain, shortness of breath. Sometimes people will feel nausea or some stomach distress, faint, dizzy. Sometimes people just feel like they're losing control or they're going crazy. People might just have a sudden fear of doom or dying. And sometimes people just feel completely disconnected from themselves. So it's pretty severe. And again, it would have to get in the way of people's ability to function. So this is pretty severe in nature. And sometimes people will wind up in the emergency room thinking that they're having a heart attack because the symptoms are so physical in nature. The next thing that I'm going to talk about is phobia. And so most people are familiar with the term phobia. It means fear, right? So a specific fear of something. And so this will be, again, it's not just like, yeah, I'm kind of, nervous about this. It's, you really can't do it, or you can't be around it, or it causes you an incredible amount of distress. So for some people, this could be something like going over a bridge or something that has caused them a lot of trauma before, but people may know mentally that it doesn't make sense. They may know in their minds, but still the phobia is there and they just can't. And so this is something that does need to cause some impairment to you. I have a bit of phobia of scuba diving, but I don't need to scuba dive for my work or for my livelihood. So I just don't do it. So I wouldn't get a diagnosis of specific phobia because I just don't have to do it. It's something that I can completely avoid. So because it doesn't cause problems for me, I wouldn't get that diagnosis. But for a lot of other people, this would be things that would get in the way of their ability to live their lives, to do their jobs, that sort of thing. Last thing that I'm going to talk about are the psychotic disorders. And these are very severe and have an impact on your ability to experience reality. The one I'm going to speak about is the one that most people have heard of, which is schizophrenia. So this is something, again, it's not something that happens once. It's something that really goes on for a long period of time. Oftentimes, we will see onset of this relatively young. So around 20 to 30 is when it tends to happen. And we would see onset. It can happen later in life though, but most characteristically, this is something that would start in 20s, although I have seen it in kids in their teens as well. And you would have some severe symptoms that really get in the way of your ability to function. So these would be delusions or hallucinations. So believing things that aren't true, seeing or hearing things that aren't really happening. People may have speech that just isn't really making sense. They may have some weird behaviors. Catatonic is where people just sort of don't speak or move and they just kind of like a statue. And it's rather frightening, frankly, for people around them to see this sort of thing. And oftentimes your face is sort of kind of drawn and not have a lot of emotion to it. So this is fairly serious disorder, and it seems to be more of a neurological basis. So medications really are the best route for this sort of mental health problem. All right, now I'm going to switch over to rural and agricultural mental health. I do want to say that rural life can be great, and I'm sure that many of you would agree that it can offer a slower pace. If you live in a rural area, oftentimes people have stronger community ties. You may know everybody. There are going to be fewer environmental stressors like noise or traffic or pollution, more opportunity to interact with the natural environment, which has been associated with positive mental health effects. In some cases, living in rural areas can be less expensive. Not always. Sometimes it can be hard to get products. Sometimes housing can be hard to find and can be very expensive. So, but I just want to sort of start out with rural life can be great, and there can be a lot of positives that are associated with it. However, it can be really tough to get both health and mental health services. It can be because of the availability. There are fewer people providing mental health services, especially specialty care is really hard to get. And this is because it's harder to get people to move out to those rural areas or to travel out to those rural areas to provide services. So that can be really challenging. And so a lot of times people will need to travel long distances in order to get their care. We've made a lot of strides in the last few decades related to what we call telehealth, right? So being able to get your healthcare online through other means. And there has been a lot of research in this area to suggest that it can be very beneficial, particularly for the people experiencing it. The research has shown that actual therapists don't enjoy it as much as doing it in person. They don't feel as comfortable, but for people actually receiving it, it can be extremely beneficial. However, it's not always possible for people to get telehealth because of what we call the digital divide. And so not everybody has access to the technology. They don't necessarily have high-speed internet, which is often necessary in order for people to be able to access this type of care. So this is something that we see particularly in rural areas. You just might not have the bandwidth to be able to do this sort of good telehealth. If you do have services available where you are, it can be harder to be anonymous. So if you've got one therapist in your town and your car is seen in the parking lot, everyone knows you're going for therapy, right? So it can be harder to have that anonymity that is easier out in more metropolitan areas. Nobody needs to know that you are seeking therapy. And we've talked about stigma. So this is something that can come into play where people may feel uncomfortable seeking mental health services in rural areas just because it may or may not be anonymous. There are some other risk factors that cause stress for people in rural areas. People tend to have lower levels of education. The number of people getting that high school degree or going on for higher education is lower. And there are fewer job opportunities, so levels of poverty are higher. And especially for children, we see higher instances of adverse events and traumatic events in rural areas. And there are greater health risks. People in rural areas are at higher risk for things like heart attack and obesity and other things, cancer. We also see, particularly, and this is more related to things like suicide, access to weapons is higher in rural areas. I will also say that for a farmer population, and I think Teresa's going to touch on this as well, people who have animals oftentimes have veterinary medicines and may misuse those. So that is something that has come up as well. And I spoke a little bit about some of the transportation challenges. In urban areas, you often have public transportation. In rural areas, you're you're pretty much on your own. And if you don't have your own vehicle or easy access to a vehicle, it can be pretty hard to get any sort of treatment. I will say, at least here in the US, we are not necessarily finding that people in rural areas have more overall mental health problems. They do have slightly higher amounts of serious mental health problems. And again, this could be related to the fact that it's just harder to get any sort of services. I do also want to distinguish between rural and frontier. And there are a lot of places in my country, but also around the world, that we would consider frontier. So these are places where there are fewer than 7 people per square mile. When you live in an area like this, oftentimes you are really cut off from urban areas. And so getting that transportation to places to get treatment can be very, very challenging. So even more so than rural areas. So I just want to mention that as well to consider, you know, there's rural and then there's really, really, really rural, which we would call frontier. Also, I know a lot of you are interested in farmer well-being. And when we talk about rural, there's a lot of overlap with farmers, but they're not exactly the same thing. There are a lot of people who live in rural areas who are not farmers. And then there are farmers who are either in urban areas or just outside of metropolitan areas and still have the metropolitan access. So, however, farmers do have some unique stressors and culture, and that makes it harder for them to be reached. And, you know, if they live in rural areas, then they've got those rural issues as well that put them at more risk and make it harder for them to get any kind of treatment. Okay. I'm just going to talk briefly about how COVID-19 has changed things for people. And, you know, most of you are aware that we have had this global pandemic and it has caused an incredible amount of stress. I don't know that anyone has gotten through this time period unscathed. While everyone is experiencing additional stress, I would say that everyone's experience of it is quite unique. I've heard people say things like, we're all in the same boat, or no, we're all in the same storm, but in different boats. And I would actually argue that we're in different storms and we're in different boats. And the storms are the amount of stressors that people are experiencing, and different people are having different stressors. Some people are having a lot of stressors, so their storm is more like a hurricane. Whereas other people, maybe it's just some light rain, right? And that's their storm. And the boats that people are in, some people are in a rowboat with a hole in it. And this is the resources that they have to come to bear. And other people are in luxury yachts or giant cruise ships, and they're able to weather the storm a lot better. So people are really bringing to bear different resources. If you were kind of not doing so great prior to COVID, if you were already struggling with mental health problems, the stressors that came about with COVID-19 have likely made things worse. And certainly all of the isolation that has come about through COVID has made things harder and more challenging, and harder for people to get the support that they need. So we know that it's very important for people to do what they can to manage their mental health during this time period as best they can. So there has been some preliminary research. I mean, you know, we're still in COVID times, but people right away started trying to do some research. And as the research has come out, we've seen some findings. And yeah, as you might expect, people are more isolated and it makes them more lonely, and that adds to their stressors. We've seen higher instances of depression, anxiety, and suicidality. We've also seen an increase in abuse and neglect of children, which is unfortunate, and some domestic violence. I would say people who are most vulnerable are going to be those people who are isolated, who live alone, who aren't well connected socially. Anyone who was struggling previous to COVID with any sort of depression or anxiety or other mental health problems. People whose normal resources aren't available to them. So maybe you'd been doing pretty well, but now you can't get out to the people who really gave you some social support or getting the treatment that you normally would get. People who are having to work long hours during COVID times are most vulnerable. And people whose jobs expose them to COVID-19 are also having higher impact, as well as people who are having those multiple stressors. Farm Bureau has done a few surveys in recent years related to mental health. They did one it came out around 2017, talking about what was going on mental health wise with farmers, and this is for US. They recently did one during COVID to see whether there were any changes. And what they found was that 66% of farmers and farm workers said that the pandemic impacted their mental health. So that's a lot. And more than half of just rural adults and farmers and farm workers felt that they were personally experiencing more mental health challenges compared to a year earlier, so before COVID. A lot of them felt that there was more social isolation, which was negatively impacting their mental health. And there was a lot of agreement that availability and access to treatment and stigma increased, as well as barriers to treatment. So it is, we have some concrete evidence, at least here in our country, that there have been shifts. And this is not surprising because of the stressors that our farmers have been experiencing and some of those changes to the supply chain that have gone on, that have made things even harder for farmers than they were prior to COVID. So I want to talk just real briefly about suicide. This is something that a lot of people use as an indicator that mental health is not going so well. We are seeing that farmer suicides are increasing, but I just want to point out that suicide isn't an actual diagnosis. And a lot of times we associate suicide with being depressed. And sometimes being depressed leads to hopelessness and then people become suicidal. But it is not uncommon for people to become suicidal rather abruptly. And so sometimes without any sort of history of diagnosis or mental health problems previously. And the key is actually this feeling of hopelessness. So sometimes people who were otherwise doing fine, they were doing great, and then they have some sort of tragedy befall them and they feel really hopeless and feel as though they can't cope with the situation, and they start thinking about suicide. And if you have easy access to methods to kill yourself, this can put you at greater risk, and not being well connected to other people can also put you at greater risk. Okay, I'm going to take a quick break here and take a look at the Q&A and see if we have any questions. And I just wanted to do a quick check-in and see how you are seeing, what sorts of things you are seeing in the countries that you're in, and what some of the concerns are that you are having. Okay. One of the questions that I'm seeing here is, how can you validate that the person doing the assessment for a mental condition does not have a mental condition? And the answer is you cannot. In the mental health field, part of our ethics are that if you have a mental health condition, you should receive treatment for it, and you should not engage in mental health treatment if it is impairing your abilities. So theoretically, they should be competent when they do the mental health assessment. But that doesn't mean that they don't have a mental health problem themselves, but they may be treating it, and that's okay. So, but yeah, I mean, you can't validate that a doctor that you go to see doesn't have health problems, right? So, one would hope that they are competent. That's part of your ethics, but there's never any guarantee for sure. I have seen a change in attitudes to the more aggressive side when collecting data at farm visits. Okay, that's really interesting. Can you maybe elaborate what you mean by aggressive? And maybe people are more angry, or are you talking about stressors that people might be experiencing? Farmers are showing underlying hostility, but after speaking to them, you realize that it is fear. Okay, so that makes some sense. What I will say, and we'll talk a little bit about this at our next meeting, is, you know, when you're under a lot of stress, you're not at your most charming, right? So this is part of the effects of stress. Right now, we're all experiencing a lot of stress with COVID. So I think we need to show each other a lot of grace and understanding that, you know, people might be irritable when they're under stress, and this can certainly have an impact. But I am sorry to hear that, that you are experiencing that. Here in the US, you know, part of the reason that I got interested in this topic is here in Florida, we were noticing that when we had some big events going on, it was really impacting our farmers, and especially after hurricanes. So we had some folks doing some research here in Florida on the effects of hurricanes, and we were looking at our extension offices. And we had farmers going into extension offices and threatening suicide because things had gotten so bad, they experienced such extensive damage. And we found that our extension agents, really, they don't have, like, as we mentioned earlier, and I think Norma mentioned, like, you know, people don't have this expertise. Or maybe it was Carl, like, you know, I know about plants or I know about animals. I don't necessarily know about mental health or how to help somebody who is threatening suicide. So one of the things that we're working on is how to strengthen the knowledge and expertise of our folks in extension so that they know how to handle those difficult situations should they arise. And also trying to increase our prevention efforts. And we'll talk a little bit more about that next time.
Heidi, there are a few comments in the chat.
Okay, hang on. They would have been more open and friendly in the past. Now they have lack of interest to share data and stand off. A usual visit would be 60 minutes, and now it's more like 10 minutes. And I think as people, I can see where that would happen when people are under so much stress. Their mind is elsewhere, maybe. Maybe the data is not at the top of their priority list right now. They have a lot of worries. So, you know, I'm really sorry that you're seeing more of that, but yeah, I can completely imagine where that would come from. Take a look in the chat, see what else we have here. Okay. Okay, I've not worked with anyone. I'm an extension that seems to be affected, but it comes up a lot in the press and otherwise. So you've definitely seen this more in the press. When the entire family gets quarantined, the entire workforce for that farm may be down. Ah, yes. So that can really have some negative lasting impacts for that farm when you have something like that go down. People can't necessarily do what they need to do. They can't sell their product. They can't get it out. I mean, that's a tragedy, right? And so that's huge. And that has really impacted farmers. So, so for Farm Bureau, this is something that we have here in the US, and this is an agency, it's a nonprofit where people who are engaged in farm work are all part of this organization, and they do a lot of helping advocate for farmers here in the US. It's not obligatory, for sure, but they do advocate for farmers, and they do have particular services to help farmers, and they're an avenue of getting support for information or difficulties. So thank you for these great questions. Okay, I'm going to go ahead and let Teresa go ahead and put her presentation up so we can move on. Let me go ahead and stop sharing. And I will let Teresa, and I will go ahead and mute, and Teresa, I will let you go ahead and get going.
All right, thank you, Heidi. Just 1 minute, let me figure this out. Okay, thank you for your patience. Can everyone see my slides? We're good? Okay, awesome. Thank you so much, Heidi. For my portion of today's webinar, I am going to give a brief overview of farmer mental health globally, specifically discussing what existing research tells us about specific factors which can lead to the type of mental health issues about which Heidi spoke. So now you kind of understand mental illness, and now we'll understand how it specifically applies to agricultural communities around the world. So first, I will give a brief background on the research we have about farmer mental health, and then I will jump right into discussing risk factors. So these are the things, those external stressors that increase farmers' chances, specifically farmers' chances of developing mental health issues. And we'll end with a 15-minute Q&A. So if you have any questions, please go ahead and type them in the chat. And I really look forward to getting feedback and hearing how you respond to this information, how it applies to your communities. So Heidi talked about this. Mental health issues among farmers was increasingly being seen as a global problem even before COVID-19. And you can see here I have these are headlines from different articles around the world about mental health crises among farmers. So we've got Australia, the US, India, let's see, this one's Canada, the UK. And we know, right, that farming has always been and still is a very stressful profession. But as many of you've noticed, as Carl talked about, it seems to be getting worse, that kind of the stress has grown into something worse than just normal, it's a rough time, to something bigger where it is a mental health crisis, excuse me. This increase in mental health issues among farmers, again, even before COVID, should perhaps not be so surprising given the really radical changes which have occurred and are still occurring in agriculture. What was once a relatively self-sufficient family farm-based model of agriculture has been transformed into a technology and market-oriented global industry, and it extends from production to sophisticated agri-science to agribusiness. And this has affected really all farmers everywhere. And these changes, although not necessarily negative in and of themselves, it has forced many farmers out of the profession. And those who have stayed have had to grapple with greater levels of uncertainty of what will happen to their livelihoods. And even farmers who have benefited from these change is very stressful. Any change, even when it's positive change. And when stress becomes overwhelming and prolonged, the risk for mental health problems and medical problems increased, as Heidi talked about. So what do we know about mental health issues in this population? Just like with mental illness, unfortunately, we don't know as much as we really need to know to make changes to global structures. But we do know enough to give us a pretty good idea. So in 2019, these three researchers, Dagagias, Wheeler, and Zuo, published a review of existing studies in English on depression and anxiety among farmers from around the world. And this is from their paper. This figure 2, it shows the number of published studies they were able to find by country. And as you can see, research into this issue has been conducted in quite a few places, but mostly in high-income countries. So especially the United States right here is number 1, Australia and the UK. Europe's catching up, and since this paper was published, Europe has really been producing a lot of literature on this topic. In my own research for today's presentation, I also included studies on suicide and stress. As Heidi talked about, suicide is not a mental illness in and of itself, but it can be an indicator of underlying high levels of stress and other mental health issues. And unfortunately, for stress and suicide as well, the sort of same trend toward research being conducted mostly in high-income countries continues. But I've tried really hard to include as much data as I can on lower and middle-income countries as well. It's also important when looking at this figure and when we talk about this issue that just because there hasn't been research conducted in a certain country or region, that does not mean there is no problem. Usually it is just a lack of resources. I mean, even the research that Heidi and I are doing is funded by the United States government in large part. So in places where there is not that support, it can be very difficult to do this research. Another is just lack of statistics. Very few countries take any sort of large-scale statistics on mental health, but even things like farm income or bankruptcies, they don't always exist, or they're not always reliable. So Heidi talked a little bit about this, but I'm going to try to summarize the research on risk factors and into 9 broad categories. But whenever you do kind of this big sort of overview of anything, there are some limitations. As I already discussed, farmer mental health is still relatively unstudied, and especially in low and middle income countries. So I'm afraid that the risk factors about which I speak today will skew toward data on farmers in higher income countries. The next is the researchers' linguistic limitations myself, and also researchers with working on this topic. I was able to do research in 3 languages, and but I'm sure that there is other research out there. There's in other languages, but I was not able to access that, and other researchers were not as well. And the next is diversity. Heidi talked a lot about this. Every farming community is very different, and even within those communities, there's a lot of diversity within agriculture. I mean, you all work with farmers. You know that the lives of small-scale produce growers are really very different from dairy farmers, right, or beef cow ranchers. And the changes we talked about have affected these different populations very differently. So while small-scale egg layers, they have really been devastated by consolidation that has been driven by just economies of scale and globalization, the beef cow ranchers are actually not that affected, at least in the United States. And so what might be a big risk factor for one industry may not be for another, right? And this also applies to, like I talked about, the medical system or the economic system or the political system. So this is something that is very variable, not just between countries, but also just between different communities and culture. Heidi talks about how we think about mental health, how we think about health in general, how we think about farming. And it can really vary by culture, and this affects mental health issues, our health as well. And the last limitation is just data issues. Heidi talked about this as well. a lot of different researchers are working on this topic, which is wonderful. But they get very different data sets. So an anthropologist will go in and they'll talk to 15 farmers and they'll get all this great, rich interview data. And they'll come away with a very good understanding of this specific community and what's going on. Whereas an economist will maybe look at more macro data, such as farm income or suicide rate, official suicide rates. So we can get different pieces of the puzzle and different perspectives, but it's hard to paint a really comprehensive picture of what is going on. That said, the existing research does tell us some very important things. And the first and most important is that the mental health issues are a serious problem among farmers worldwide. Problems such as elevated levels of stress, depression, anxiety, and suicide, these are not limited to a single place or industry. That they are affecting many farmers in many places. The research also tells us some of the key risk factors to help us understand why these problems are so pervasive and why they seem to be getting worse. The research also tells us that although mental health issues among farmers is a serious problem around the world, it is not an inherent aspect of farming. Risk and protective factors vary greatly by region. So this article that I cited earlier by Dagagyaz and company, in their big review, they found that 18% of studies showed that farmers actually have a lower prevalence of mental health problems than non-farmers. So farming doesn't have to be an inherently stressful occupation that tends to lead toward the farmers developing mental illnesses. Rather, these crises that we've talked about, they are due to complex, interrelated economic, political, cultural, Heidi talked about biological, psychological, and geographical issues. So for the remainder of this presentation, I will be introducing some of the most commonly identified risk factors. It's important to remember that these are all very interrelated and there's no one real smoking gun, so to speak. Let's see, there we go. So in order to illustrate the complexity of these issues, and Heidi talked about this, I would like to show you this slide. This is a visualization of suicide risk processes from a study of suicide survivors in Japan. And there were probably no farmers in this sample. This study was conducted in Tokyo. I think it does a really good job at illustrating how it's not there's never one thing. It's a host of interrelated factors that lead people to attempt suicide, and that some people are affected by some factors and some people aren't, that these factors influence one another, but there are some big ones that tend to affect a large portion of people who could attempt suicide. And so like the people in this sample, there is strong evidence that there are farmer specific factors that might contribute to the apparent high suicide rates in some populations of farmers. So these are the risk factors we will cover today. Okay, so let's get into this. So the first one I want to talk about, and these are not necessarily in order of, most detrimental, because it's such a complex topic, it's hard to attach an order. This is how I think, the ones I think are most important for a global audience to understand. And financial distress is definitely at the top of this list. It has been perhaps the most widely identified cause of suicide, depression, and anxiety among farmers worldwide. And these sources of distress include market prices for crops and livestock, high levels of debt, cash flow issues, increased input costs, taxes, and healthcare costs. And as I talked about already, the fact that so many producers are experiencing financial distress is not that surprising, considering just all of the changes that have occurred and continue to occur to the agricultural landscape. And the reasons behind this widespread financial distress among farmers are also very complex. And I'm afraid a full discussion on this topic, for its own webinar. It would take another couple hours, but I have listed the big ones here. And again, although these trends toward technological innovation, et cetera, are not necessarily negative in and of themselves, they do overwhelmingly advantage larger farmers with more capital and make it harder for smaller scale farmers, in particular, to remain profitable. If you have any more specific questions on the economics of farming and financial distress, please type them in the Q&A. So for millions of farmers, and this is especially small and marginal farmers, these changes that are listed here have resulted in the loss of the farm, in their inability to make a living farming. And in any circumstance, losing a job is very traumatic. It can mean losing your livelihood, but also your identity. And farming in particular is often very much tied to family and individual values and self-worth and purpose. And this is tends to be true for male farmers. So the perceived failure to hang on to the family farm, to pass it down, to keep the land in the family, this can be really devastating. So this photo right here, this is from a recent Washington Post article about, this is a dairy farmer in the US state of Wisconsin who he lost his farm because he could not compete with the mega farms nearby. And he developed depression, and his son actually died by suicide. And dairy has especially been hit hard. And I'm sure in Europe too, and really all over the world, there are many examples of people like farmers like Mr. Messelt. However, financial distress, it's widespread. It's a widespread problem. It is not always associated with mental health issues. So, for example, in New Zealand, there's been a lot of research on mental health, and researchers have repeatedly failed to find a link between financial distress and mental distress. So there are things we can do. This is also true in the United States. Farm suicides are actually far lower now than they were in the 1980s when they were really peaked. Even though they're still too high, they're still elevated. There are things we can do, like having sort of humane legal infrastructures like bankruptcy law. Agricultural cooperatives can help protect farmers, access to public support programs, and these are next week. These are the things we will be talking about next week. So please stay tuned for next week about how this doesn't necessarily have to mean mental health issues, financial distress. Okay, so the next one I would like to talk about is pesticide exposure. It is really well established in lab and in larger epidemiological studies that acute and long-term exposure to pesticides can lead to serious neurological problems. So among agricultural workers, cognitive problems such as difficulty concentrating, confusion, memory loss, as well as mood and personality disorders, so depression, sleep disturbances, are well documented. This is actually one issue that has been better studied in developing country literature, so Mexico, Brazil, India, Nepal, the Philippines, because in the developing world, where there are growing populations, increased urbanization and growing economies, they create a demand for more food produced quickly and inexpensively. And so pesticide application rates are rising. But it affects nearly all farmers, including the United States, who work with pesticides, which is most farmers. So this is another big problem in the US, Japan, and South Korea at least. And the research on this topic showed that a large percentage of farmers and farm workers in all countries where they use pesticides do not properly use protective gear and do not have access to it. And unfortunately, even if you do use protective gear, it's not 100% effective at reducing or preventing exposure, excuse me. And as you can see on this side, pesticide usage around the world is high and is expected to increase as populations, especially in developing countries, as populations continue to increase. And it's important. I mean, sometimes a lot of farmers, they need to use pesticides to produce enough food for them and their families, and but they don't understand the risks, and the social systems don't allow for them to access the protective gear they need, or employ farming methods that use fewer pesticides. So this is something I think, especially as rural advisors, that we can just increasing the knowledge of this very significant risk is a wonderful thing we can do for our farm communities. So the third risk factor that I will speak about is social isolation. Heidi talked about this, and I'm sure we've all felt the negative mental health effects of social isolation during the year. But even before the pandemic, this was a very significant problem in rural populations. And it's mostly associated with industrialized countries with low birth rates. So Japan, Italy, Spain, but it's also increasingly an issue in emerging economies like India, China, and Mexico. In many countries, the majority of agricultural workers do live in rural areas. And like Heidi talked about, the social isolation is directly related to increased risk of disease and death. And both of which are elevated in rural areas compared to urban areas. This is also, I think, especially in these countries I talked about, Japan and Spain and Italy, the social isolation is associated with negative health effects on seniors, but it's also very hard on children because living in a community where depopulation is occurring, it can breed a sense of hopelessness. These kids, they grow up knowing that they'll probably have to leave to go to get a post-secondary education or to make a living, that they can't rely on the industries that supported their parents. And this can be very, very difficult. And in addition to this depopulation, a lot of times the geographic distance between neighbors, the lack of transportation, the poor internet, about which Heidi spoke, it can exacerbate this sense of isolation. And this has only grown worse since the pandemic began. So number 4 here is health issues and chronic pain. So studies have consistently found higher rates of mental illness among farmers who have poor physical health, past injury, or work disability. And as we know, farming is a pretty dangerous profession. It is one of the highest risk groups for occupational injury and illness around the world. And so farmers are at high risk for health issues and chronic pain. And chronic pain and injury can also lead to substance abuse. This has especially become an issue in the US and Canada in the past 2 decades, as more and more doctors have been prescribing opioids for chronic pain. This has resulted in an epidemic of opioid abuse, which has led to all sorts of social and mental health issues. There's still not a lot of research about how specifically opioid abuse has affected farm communities, but a 2017 poll by the Farm Bureau, about which Heidi spoke, found that 74%, so almost 3/4 of American farmers, had been affected by the opioid crisis. So related to the health issues, and Heidi already spoke about this, are barriers to healthcare. When we talk about access to healthcare, sometimes it's helpful to think of the 5 A's. So affordability, availability, accessibility, accommodation, and acceptability. Like Heidi talked about, a lot of times farmers, especially in low-income countries, they don't have the money to take care of those physical problems, much less to see a psychiatrist or a therapist on a regular basis. And in the United States, where we do not have the universal health care, a lot of times farmers are self-insured and they have very high deductibles, and so they don't want to pay, or they can't afford to pay for that health care. Availability, like Heidi said, global shortage of healthcare providers, especially mental health care providers, and this is especially true in rural areas. Accessibility too. Many farmers, they live in the countryside, they can't drive 2 hours, they can't take the train or the bus 2 hours to go to the doctor. And there are very few services which will come and visit them at their farm. Accommodation, this is a big one. Many times farmers, when they'll go to, they finally get the money, they get on the bus, they go to the city, and when they get there, the providers do not understand their needs. They don't understand what it's like to be a farmer or to live in a rural community. And this can make it very difficult for them to continue seeking care when the care does not accommodate their needs. And acceptability, and acceptability is whether care is considered relevant, beneficial, and worthwhile. And like Heidi talked about, stigma, it's a major issue, a major barrier to seeking treatment, especially among rural populations. And this is really all over the world, unfortunately, although it does tend to be, the stigma tends to be far worse in rural areas and in low-income countries. In addition, in many farm communities, there is a very deeply held cultural value of stoicism, of just working through the pain and self-reliance. And this can be a barrier to seeking help for both physical and mental health issues, especially among male farmers. Okay. So number 6, this is access to lethal means. This is, and Heidi again spoke about this, this is especially true, this is true for suicide, risk of suicide. This has been identified as a risk factor for suicide among farmers in the US, the UK, Australia, New Zealand, India, and Japan. And the reason farmers are especially at risk is because they just tend to have more access to lethal means. In many countries, not in the US, but in many countries, acquiring a firearm is really a long and difficult process. And so rates of gun ownership are very low among the general population, but many farmers will have guns because they need them for farm management. My grandparents were farmers, and I mean, my grandma, she needed that shotgun to go shoot minks in the chicken coop on a regular basis. The reason why access to lethal means is dangerous is because while some suicides are very deliberate and involve careful planning, many are really hastily decided upon and involve little or no planning. Usually the person has some sort of underlying chronic problem like substance abuse or depression, but they will only attempt suicide during an acute period of really heightened risk when they just feel like their capacity for emotional pain has outweighed the amount of time they're able to wait. They just can't bear it anymore. And this acute state can last, it can only be minutes or hours long, but having access to that extremely lethal means, like a firearm, can lead to very lethal results. Research has repeatedly shown that restricting access to lethal means, such as firearms or dangerous chemicals, does help lower suicide rates. But for many farmers, this is tricky because the tools they need to manage a farm, so this includes pesticides, medications, and even machinery, can easily become lethal means. All right, so number 7 is weather uncertainty. And weather uncertainty, climate variability has been identified as another large risk factor for farmers, mostly in studies in developed countries, but also in India, Ghana, and Iran. And unfortunately, it is predicted that severe weather events and widespread droughts will increase in the future. So climate variability adversely affects farmer mental health in various ways. The first is the obvious fact that of the financial losses which can result from a disaster. As we talked about earlier, many farmers are already struggling. They struggle to keep a farm profitable during the best of times. And a single adverse weather event can wipe out their entire crop or even their entire farm. And losing a crop, losing livestock, losing your home and your community, it's extremely stressful and is linked to depression and anxiety. Interestingly, exposure to extreme heat can also lead to, it's been documented to lead to the increased use of alcohol to cope with the stress, increases in hospital and emergency admissions for people with mental health or psychiatric conditions, and an increase in suicide. So although office workers, such as myself, when there's a heat wave, we can go inside or we can stay in the shade. But this is a luxury that is not available to farmers, and they can suffer worsened mental health issues as a result. And for farmers who are dealing with sort of longer term issues such as desertification or climate change, this can lead to a real loss of identity. Like I mentioned, farmers are often very attached to their land, to the place where they farm. And when they can no longer farm there because the ground is no longer fertile or the temperature has changed, they have to relocate, and this can be really unmooring and psychologically traumatic. All right. So another big one is actually regulation, compliance, and paperwork. When I first began doing this research, I was surprised to learn that farmers in many countries would actually rank regulation, compliance, and paperwork as more stressful than financial distress. I should not have been that surprised, considering, again, all of the changes that have occurred in agriculture. This is especially true in industrialized countries where there have been a lot of increases in regulation and very complex subsidy systems. This is especially true in Europe, but also more demands from buyers about different standards that the farmers have to meet. And regulation compliance, it often requires farmers to juggle a really big range of administrative tasks. So they have to report to several different bodies, and they have to keep an account of different practices. And in addition to just the amount of time and hassle that these causes, this is also very anxiety provoking because they can be penalized if they get it wrong. So it's kind of twofold stressors. And furthermore, regulation changes can often be sudden, unforeseen, expensive, and come down from bodies that seem to not understand the issues which farmers are dealing with. So this image of Dutch farmers swarming The Hague, this happened in, I think it was 2015, when the Dutch Council of State made a sudden change in regulations, which was very expensive for farmers to implement. And they were understandably very upset about this change. This kind of sudden changes in regulations from these opaque bureaucratic bodies, this is just one part of a real sense of marginalization that is increasingly felt by farmers around the world. Many farmers have found that between the intensification of government regulation and administrative demands, the real imbalance in market power between farmers and the agribusinesses that they buy from and that they sell to, and these really complex and uncontrollable global forces bearing down upon them, that they have really lost any sense of autonomy and self-determination that maybe their grandparents enjoyed. In the United States and in many parts of Europe in the mid-century, in the 1950s, you could be a smallhold farmer and it was hard, it was still rough. I'm thinking of my grandparents. But you could support your family with only farm income. You lived in a more vital rural community, and you had the hope of looking forward to passing down the farm to the next generation. And for many, many farmers today, that is just not an option. You need to have an off-farm job. You're probably telling your kids, try to find something other than farming. It's gotten very, very difficult, especially if you're a smallholder, if you're a smaller farmer. And as I mentioned earlier, in the US, the UK, and Australia, this is especially difficult for male farmers, as they feel like they're failures and traitors of the family legacy. In other countries, the US, Canada, the UK, and Europe, farmers, to kind of add insult to injury, they are vilified by the media as polluters or animal abusers, or dependent on government handouts. And this really feels like a deep betrayal, because many are working so hard, they're struggling so hard, and they feel like their society and community has just really abandoned them and let them down. So these 9 that I talked about, there are more, but these are kind of the big ones. And as you live today, I want you to think about how the transformation of agriculture from more of a subsistence-oriented, farm-centered one into a global, commercialized, off-farm-centered one has been extremely stressful for farmers. And the issues we talked about today, financial distress, pesticide exposure, social isolation, health issues, barriers to healthcare, weather uncertainty, regulation compliance, and a sense of marginalization have been linked to mental health issues in farmers. So I know this was a real downer presentation. Many of these problems, they're very complex and they seem really overwhelming. But there is good news. And the good news is that there are things we can do. There are things that communities and states and individuals are already doing to make this problem better, to create a society where farmers can do not have to suffer so much and can live mentally healthy work lives. And these are the interventions that we personally can make, that our communities can make, is the topic of next week's webinar. So I hope you will join me then. Thank you very much for your attention. That's all for me.
Teresa, I wanted to let you know that I think there's a question in the chat and the Q&A. You may want to take a look at it.
Yes. Let's see, do the risks associated with pesticides go down if use ceases or exposure is a long-term risk? Or when they hand down the farm and stop farming, will the risk go down? That is a very good question. I would say yes, because accumulative exposure is it's acute and accumulative. So even just one bad exposure can lead to mental health issues, but a lot of times it's just that long-term use. Eventually it will get into you. And so yes, if you're able to reduce chemicals, the sooner the better, the less kind of overtime exposure you will have. So yes, thank you for that question. And there is some evidence out of the United States that organic farming is somewhat more protective of mental health, probably because of the pesticide exposure. So, other questions? Let's see, let me look in the chat here. I guess we have Heidi here. Any questions for Heidi?
We do have quite a bit of time left, so if persons want to unmute their mic to ask a question. Heidi, was that all you had to present?
Yes.
Okay.
I would just sort of like to emphasize, though, we've talked about all of these issues. So what is going on with farmers, and some of the things that Teresa identified, these are stressors, and they can affect your mental health. They don't always necessarily mean that you will develop a mental illness, right? But they can tax your coping and your ability to function at your best. So your ability to be mentally healthy. And so even if it's, okay, I had this big loss, I lost the family farm, I'm very distressed. Even if you don't wind up with major depression or some other diagnosis, you can still be suffering, and your mental health will be very, very much affected. And so this is something that we're seeing a lot of. And as both Teresa and I mentioned, the suicide can come from an adverse event. People don't necessarily have to have some sort of long history of mental health problems or mental illness. It can come quite abruptly from just some very specific incidences that cause problems. One of the questions that I saw was related to whether this presentation will be sent. I think Marissa had asked that, and Norma or Ingrid, do you know if this is something that are we going to be sending this presentation out to people?
Yeah, maybe I can talk about that. We will have both the video, we will make that available, and then we can also upload the presentation to have it on our website. We will see what is the easiest way, because one thing that we seem to notice, and maybe people who are listening can also tell us, is that a lot of the links that we sent to join today seem to have landed in people's spam or junk mail. So that's what I would say. Please stay tuned to the GFRS website. I can also put that here on the chat for everyone, where we will make, the GFRS website already has the login information for the next 2 planned webinars. And we will also link there to both this recorded presentation and also the PowerPoints that we will share. I think this might be the safest way for now. And we will also try to distribute it to the mailing lists, but just beware, it might be in your spam box.
Well, we definitely wanted to leave some time for questions, just, in case people had questions. So we can hang out for a few more minutes and see if there are any more questions that come about.
Okay, ladies, you have done a wonderful job for us today. We certainly want to thank you for your presentations. And as you think about what we covered today, certainly you can send us your questions beforehand or wait until next week and ask your questions. And please do share the information for joining next week's session with your colleagues. Thank you so much, everyone. And thank you, Heidi and Teresa.
Hey,
There is one quick question in the Q&A. Yes.
Andreas, I just wanted to let you know, thank you so much. Yes, we are going to be covering suggestions for farm advisors on how to cope with distressed farmers. And that's going to be at our next talk. We're going to be covering what those options are. So hopefully that will help. Okay, if male farmers have a higher risk of suicide, what are the services consequences? I'm not sure I quite understand that one, Michael. Can you maybe elaborate a little bit on that one?
And please feel free to unmute, or maybe we may have to unmute him. Is that what's going on?
I think they cannot speak. We have to allow them to talk.
We have to give him permission to.
Yeah, I will unmute Michael here.
Thank you so much. It is about what Teresa said, that women are less, let me say, less stressful. The other way around, men are obviously on a higher risk of stress and a higher risk of suicide. Is there any, what can we do in the services? Because most of us, we are in the services.
Well, Teresa, you may have some other thoughts on this, and we're going to be talking about what we can do next time. But I will say that it's not necessarily that women experience less stress. I don't want to give you that mistaken impression. Women handle stress differently than men do. And I think this is something also with male farmers. We do see, I think Teresa had mentioned some of the cultural issues that go with farming and a sense of pride in being able to handle things by yourself and not having to rely on other people. Can really get people thinking like, I can handle these mental health issues or these stressors by myself. I should be able to. And so, yes, one of the things we need to do is getting people to identify that they are experiencing stressors and that they need help, and give them information on how to get that help is going to be certainly a piece of that puzzle for sure. But yes, women farmers also have problems, and women in general, they have at least as much stress as men. They just tend to channel it a little bit differently, and they are actually more likely to seek help than men are.
So a gender approach is needed.
Absolutely. And there is actually a cultural dimension to this. Like Heidi mentioned, men are in the West, men tend to be more likely to commit suicide than women. Not always, but that tends to be the tendency. That is not the case in China and in some other Asian countries, and in some communities as well. So I'm guessing that, Mikhail, you're in Europe somewhere. So in Europe, that tends to be the case, but not always. So depending on the kind of cultural norms, interventions need to be tailored to that. I think just as a sneak preview for next week, Heidi will talk about this, as in the services, just kind of letting the farmers know it's okay to be stressed. It's okay. If nothing, it's normal to be experiencing a lot of mental distress right now, and that's not something they need to be ashamed of, that everyone's going through it. I don't know if Heidi wants to add to that.
It's true. I would also say, Teresa, men are more likely to successfully commit suicide. Women actually are more likely to attempt. So, but they tend to use less lethal means, and so they're usually less successful. Yes, this is something that we're going to be covering in our talk next time. But I think, yes, normalization of stressors is certainly an important part. I think giving people who work with farmers some specific tools and understanding of how to speak to people who are in distress is very important. And there are a lot of great programs that exist out there that we would recommend and that we'll talk a little bit about next time. But it is important. It is important to do this for people. I think also social support, just knowing that somebody cares and is available to speak to you. Even if you're not a mental health professional, that can be really huge for people. And as we've talked a little bit about today, having those social connections is very important for people's well-being. So that is certainly going to be an important piece of the puzzle.
Norma, you have to officially end it again.
Well, sorry, I jumped in too early. I just saw that there was a lull and figured no one else had questions, but I
see, oh, Norma, wait, I see a couple more people.
Okay, well, keep them coming.
I see Tamara said, how do you see the role of extension? So here in the US, we have extension, and those are the people who work a lot of times with our farm communities. And I see a couple of things. One of the things is if we who work in extension have a better understanding of what's going on and learn just some like minor skills that can really help us to be more available to our clientele who are in distress, I think that in and of itself could be huge. And I think with an extension, we can also provide educational programs to people who work in extension, to other people who work with farmers, and to the farmers themselves. We can generate publications and develop programs that will, so I definitely see an important role for people in extension. I mean, we're probably one of the groups most connected to farm communities. So I think, and often we're more of a trusted resource than some others. So I think that we have a very big role. The next question I see is, do we think about burnout as mental health? Okay, yes. So it's not necessarily mental illness, but people get burnt out in their professions for a number of reasons. And that is when your mental health is suffering. So maybe you don't have a, mental illness, but your mental health is suffering. And it is usually related to being under high stress for long periods of time, inability to take breaks, and it is associated with lack of support or control in your environment. And a lot of things can go along with farming, right? It's a demanding job. It is hard to get away. You can't easily just take vacation time when you have a farm to run. So certainly burnout is a factor, and that is something that can affect people's mental health and well-being for sure. And yeah, that is another one of those risks that come along with this profession. So trying to help people manage their stressors is going to be one of the first things that we will talk about at the beginning of our next session, talking about the role of stress and how we can help people, because if people are not dealing with this all along, it does accumulate and it gets harder for people to be mentally healthy. And you do have higher risk for burnout then.
Just want to tack, thank you, Heidi. Want to tack on really quick. I lived in Japan for a long time, and in Japan, burnout actually is considered a mental health condition. It's called, let's see, Moitsuki Koshogun, some sort of burnout syndrome, and actually can be a diagnosable way, a reason for you to take breaks from work, right? So that's another thing to think about, is how do cultures define burnout? How do we as a society, maybe that's something we need to think about. Is burnout something that a doctor can write you a note for, and you can take a break? If you're a farmer, that's harder, but maybe the bank can cut you some slack, right? If you're on loans and whatnot. So yes, thank you, Heidi.
Yeah, that is not a diagnosis here in the US for sure. But it does affect your mental health, your health. It's not illness, but it is your health is impacted negatively, and it can lead to some serious consequences. So, you know, people are not going to be as productive. They are at higher risk for developing mental illness. So it is very important. So thank you for bringing that issue up.
Okay, thank you, ladies, and thank you everyone for joining us. Have a wonderful weekend.
We look forward to joining you next Friday.
Oh, so there's another question that you could probably answer next week, or if you want to answer now.
Social farming programs. Well, we'll talk a little bit about what's been done, and hopefully that will answer your question. Okay. All right, guys. Well, thank you very much for having us, and we look forward to meeting again next Friday.
Okay, thank you.
Thank you.